Mr. Speaker, I rise today with a heavy heart, but also with a sense of hope. I want to tell you about a remarkable young man named Ian Calvinus. Ian was one of my interns this summer, a Pasadena native. He loved soccer and carried a curiosity about the world that was boundless as his spirit. As a UCLA student with a deep passion for public service, he dreamed of pursuing a career in foreign policy and one day working for the United Nations. At just 15, though, Ian was diagnosed with liver cancer. He underwent a transplant at UCLA, and for more than 4 years seemed that he had beaten the disease. But in November 2024, his cancer returned. Ian knew his time was short, yet he refused to let that define him. Instead, he came to the Capitol Hill because he told us, "I want to make a difference." Even while battling the illness, Ian focused on helping pediatric patients get fair consideration on the transplant waiting list. Sadly, Ian's internship was cut short. He passed away in June at the age of 20, surrounded by his family in the shadow of the Capitol he so admired. His doctor, Sue McDermott, one of the premier transplant physicians in the world, told me his personal courage was remarkable and an inspiration to her and all that knew him. But his final days were not defined by his illness. They were defined by his courage and by his idealism, by his determination to use time he had left to help others. In honor of Ian's life, I'm proud to introduce the Ian Calvinus Pediatric Liver Cancer Early Detection and Screening Act. This bill will advance the very work that Ian hoped to pursue. It would direct the Department of Health and Human Services with input from the CDC's Center for Disease Control to strengthen education to parents and providers to spot early signs of liver disease in children. It would require the Government Accountability Office to report on what we are doing now and how many children are lost each year while waiting for a liver transplant, or whether adding a simple newborn test could save lives. Mr. Speaker, Ian's story is not an isolated story. Over 100,000 Americans every day are waiting for an organ transplant. Back home in the San Joaquin Valley, Austin Salinas, a young boy, has spent his life battling hypertrophosis, a serious kidney condition that has meant countless surgeries and now the use of an ostomy bag. More than 11 years has defied the odds with remarkable resilience. Like Ian, his journey is more than endurance. It's about survival and the hope of a life-saving transplant. It's about inspiration. It's about courage. These young people who really want to live and have a full life. Families like Ian's and Austin shouldn't have to fight alone. They deserve a system that works for them and gives them every chance to live a full and healthy life. This legislation is about the gift of life and giving better opportunities for over 100,000 Americans awaiting an organ transplant every day. I encourage my colleagues and their staff to take the time to read this bill and consider joining us. By supporting this legislation, we ensure that Ian's fight and the legacy will live on for the lives of children and their families in the future that will be saved. I ask my colleagues to join me in honoring Ian Calvinus and his son, a student, and now through this legislation, a catalyst for change. God bless you, Ian. May his memory continue to light a path forward for all of us. I yield back the balance of my time.